Good. My name's Adriana and I'm the nurse today. How are you feeling?
Good.
Good. And how far along are we?
18 weeks.
18 weeks. Are you having any symptoms? Are you still feeling morning sickness?
No, I started to feel better. Yeah, maybe like 2 weeks ago.
And no headaches? Okay, how's your diet been?
It's been pretty good.
You've been having a good appetite?
Yeah, I've been eating pretty fine.
Okay, like 3 meals a day, 2 meals a day?
Probably like 5 small meals, like nothing, like, I can't tolerate a lot of food all at once, but
Right.
pretty
Well,
good.
that's normal. And have you thought about a birthing plan?
I have been doing a little bit of reading online, maybe like I've been interested in some water birth and then just kind of like a more natural option.
Okay. And Dad's against it?
Yes, I don't think it's a good idea. I've heard that the baby can choke, and then it's gonna land in all that water, and that water's been sitting there for a while, so that doesn't sound like a good idea to me.
Right. Well, there are a bunch of alternatives for alternative birthing plans, and I'll definitely have the doctor come in and answer some questions that you guys may have. Okay.
Guys, I'm Dr. Paget.
Hi.
Your labs looked great, your ultrasound looked great. So if there aren't any other questions, y'all can go ahead and go home.
Okay, I still wanted some more information about the water birth. I've been doing some reading online, but
Okay, the nurse did say you had a couple questions. Conventionally, common practice is we just do a normal spontaneous vaginal delivery or C-section here in the hospital. If you are considering going an alternative route, I can have our midwife come in and talk to you about that.
okay, yeah, I want to talk to her.
Yeah? Okay, well, I'll go there.
Good afternoon, I'm Janae, the nurse.
Good afternoon.
How you doing?
She's so nice.
It's been brought to my attention that you are interested in the water birth as a method for labor.
Yes.
Okay. You're not interested?
No, ma'am.
May I ask why?
What about the baby drowning? Isn't that a risk?
Well, no, the baby doesn't run the risk of drowning because while the baby is in the womb, he or she is in the amniotic sac and they're dealing with the amniotic fluid. And all oxygen is delivered to the baby through the umbilical cord.
Oh, okay.
The baby doesn't start actually breathing on its own with the lungs until after they're delivered and stimulated to begin the nose breathing.
Oh. What about the water? Won't he get super cold?
No, because after the baby is delivered, we're gonna pull him out the water, dry him or her off, and then we're gonna suction and everything that needs to be done to keep the baby warm and breathing correctly.
Oh, thank you.
So the water birth method is still being researched, but it has been proven that the benefits do outweigh the risks currently. It provides a non-pharmacological method of pain management.
Yes.
It provides a relaxing environment for the mother who wants to deal with it naturally and just let the baby just flow and let the flow of gravity do its work.
Yes, that's what I want.
In the 20 years that I have been doing this, I've had way more good outcomes than I have had bad. So if this is something that you're interested in, we can discuss this further.
Okay.
I see that you have insurance. Water birth is a substantial amount, like finances, it is a lot. A lot of insurance companies do not cover water birth as a method. I understand you have TRICARE. I think that they do cover it. I'm not sure, but if you would like to talk more about the financial aspect of it, I do have a case manager that you can speak with.
Okay, yes, please.
All right, I'll go get her.
Hi, I'm Cassandra. I'm the case manager. So I'm here to discuss the finances with y'all.
Okay.
So I saw that you have insurance, correct? It's TRICARE? Okay. Well, I'm here to discuss the payment options. TRICARE does cover it, most of it. So the total of the whole birth would be around $5,000 to $10,000. So I can set up payment plans for y'all and just start talking to you about the doulas and the midwife costs and just helping you out with all of that, okay? And I will make sure you have the resources and the pamphlets before you go home, okay?
Okay.
All right, thank you.